entrance exam and also in university exam. Now let's try to understand the different types of epiphysis in this short module. Before we learn about different types of epiphysis, we must know what is an epiphysis. For that, we will learn about what are the parts of a growing bone. In specific, what are the parts of a growing long bone. Then we will talk in detail about the different types of epiphysis, what are their characteristic features and what are the examples for them. Right? So first let's begin with trying to understand what are the parts of a growing bone. We will draw a simple diagram to understand the parts of a growing long bone. So what we have is, we have a middle portion which is elongated and we refer this to as the diaphysis. Right? So we have the diaphysis. Right? Then we have an upper end which is referred to as epiphysis. Not only upper end, we also have it along, let's say, the lower end. So these are the epiphysis, right? Then in the middle we have a area which is formed by a plate of cartilage and we call this as the epiphyseal plate of cartilage. Epiphyseal plate of cartilage, right? Then the other part is the upper end is formed by the upper end of the diaphysis is also a separate area and this area is known as the metaphysis. Let's try to understand what exactly are these distinct parts. First, let's start with the epiphysis. Remember, epiphysis is the ends of the bones and to be more specific, they develop from secondary centers of ossification. So epiphyses are parts of the bones which develop from secondary centers of ossification and they are present more towards the ends of the bones. Then what about diaphysis? Diaphysis forms the middle or the shaft of a growing long bone and this develops from primary center of ossification. So that is the definition of epiphysis and diaphysis. Epiphysis is the ends of the bones that develop from secondary centers of ossification, whereas diaphysis is the middle part of the bone that develops from primary center of ossification. Right. Then what about the epiphyseal plate of cartilage and metaphysis? Remember, the epiphysis and the diaphysis are separated by a thin plate of hyaline cartilage and that is what we know as, this is a plate of hyaline cartilage, right? So this is what is known as the epiphyseal plate of cartilage. The fusion between the epiphysis and the diaphysis occurs because of growth of hyaline cartilage, right? Then what exactly is metaphysis? Remember, metaphysis is the end or ends of diaphysis, right? It is the end or the two ends of the diaphysis and remember, this is the active area for the growth. Active area for growth of the bone. So actual growth occurs at the metaphysis and metaphysis is the highest vascular area of a bone. This is regarding parts of a growing long bone. Once we have learned this, let's try to understand what are the different types of epiphysis that we have. So first, what do you mean by epiphysis? Epiphysis is part of the bone that develops from the secondary centers of ossification. Secondary centers of ossification. Right? So epiphysis is divided into these following types. What are they? First, we have the pressure epiphysis. Right? Then we have traction epiphysis. So we have traction epiphysis. Then we have aberrant epiphysis, and then we have atavistic epiphysis. Atavistic epiphysis. Now what exactly are these? The pressure epiphysis, remember, they help in transmission of weight. They help in transmission of the weight. And they are usually articulating surfaces. Right? So pressure epiphysis usually form joints. The best examples for the pressure epiphyses are the head of humerus, or we have the head of femur, right? So wherever we have bones or ends that form joints and take part in the weight transmission, those are the best examples for pressure epiphysis. What exactly are traction epiphysis then? Remember, traction epiphyses are produced by the pull of muscles. Traction epiphyses are produced by pull of the muscle, and they are non-articulating, and usually they are present outside the joint cavity. Examples for this include the tubercles of humerus, right? Or we have the trochanters, the greater trochanter and the lesser trochanter, right? So remember, we have the lesser tubercle and the greater tubercle, for which we have the attachment of the lesser tubercle gives attachment to subscapularis, and the greater tubercle gives attachment to the sit muscle, supraspinatus, infraspinatus and teres minor. When we talk about trochanter, when we talk about lesser trochanter, if you remember, the lesser trochanter will give attachment to what? The iliopsoas tendon, right? So this is regarding the traction epiphysis, examples for traction epiphysis and what they are. Then what about the next type? Next we have is the aberrant epiphysis. Now what exactly is aberrant epiphysis? Remember, these epiphyses are not always present. Not always present. Examples: the head of first metacarpal. Head of first metacarpal, right? Normally the epiphysis for the metacarpals is present close to their base. So head of the first metacarpal is an example for the aberrant epiphysis, right? What about atavistic epiphysis? Remember, atavistic epiphysis develop phylogenetically as independent bone, then it gets fused with the main bone to derive its vascular supply. So basically, atavistic epiphysis becomes part of a bone just to derive the vascular supply or nutrition. So basically, atavistic epiphysis act like parasites. They feed on other or another main bone. Best example for this is the coracoid process of scapula. The coracoid process of scapula is the best example for the atavistic epiphysis. In your entrance exam, these are often asked. They will give the bone and they will ask you to identify which type of epiphysis it is. Okay, so you must know what is the definition of each type of epiphysis and what are the examples for each type, right? Fine. So once we have learned this, let's try to quickly summarize. We started with discussing what are the types of a growing long bone. Remember, a growing long bone has epiphysis, which develops from secondary centers of ossification. Then we have diaphysis, which is the shaft which develops from primary center of ossification. Then we have the metaphysis, which is the ends of the diaphysis and the most vascular area and the most active area for growth. And then we have a plate of cartilage, epiphyseal plate of cartilage, which is usually hyaline, right? Then we talked about the different types of epiphysis, and in this we have the pressure epiphysis, then we have the traction epiphysis, then we have the aberrant epiphysis, and finally we have the atavistic epiphysis. Pressure epiphysis take part in the formation of joint and they help in weight transmission. The best examples are head of the humerus and head of the femur. For